In today's Huddle, we will focus on the critical role that DFS, determination of functional status, plays in home healthcare, especially for patients recently discharged from the hospital. These assessments are not only essential for creating accurate care plans, but they also directly influence reimbursement under the PDGM payment model. Properly assessing a patient's functional status post-hospitalization is key to understanding their current care needs and ensuring they are on a path to recovery. The way these questions are scored determines the level of reimbursement agencies receive, but, more importantly, it impacts the quality and appropriateness of care provided to patients. Variations in DFS scoring can lead to differences in payment outcomes and potentially compromise the care plan's effectiveness in addressing the patient's post-hospital needs. Therefore, mastering the accurate completion of these functional assessments is crucial, particularly in managing the transition from hospital to home and ensuring optimal patient outcomes. Shaughnessy and Chrysler in 1995 highlight 4 primary reasons for the emphasis on functional ability within the OASIS framework, and this framework still holds true today. First, a certain level of independence is essential for patients to remain safely in their homes. Second, the ultimate goal of care is typically to improve the patient's functional abilities. Third, the clinical panels involved in the OASIS demonstration project concurred that functional outcomes are crucial indicators of effective care. Finally, studies have shown that functional outcomes serve as a reliable measure of overall agency performance, underscoring the importance of accurately assessing and documenting these abilities. So, in other words, if your agency is positively impacting functional outcomes, your agency is doing well. In post-hospital discharge challenges, 73% of patients report moderate to severe pain after discharge. Regarding mobility issues, 64% experience problems with mobility and impaired stamina. On the other hand, patients face persistent disabilities in activities of daily living and instrumental activities of daily living. Since the majority of patients managed by Valley Health Home Health are referred from hospitals or skilled nursing facilities, it's essential to understand how post-hospitalization impacts their ability to perform daily tasks. Physical limitations are common after a hospital stay, as patients often experience deconditioning, muscle weakness, or lingering effects of acute illness. Extended bed rest and inactivity can result in reduced physical strength, balance, and endurance, making it challenging for them to perform basic activities like walking, bathing, or transferring without assistance. Emotional, cognitive, and behavioral limitations also play a significant role in post-hospitalization recovery. The hospital experience can be traumatic, leading to cognitive impairments or emotional distress such as anxiety, depression, or confusion. These factors can complicate recovery, making it difficult for patients to manage tasks that require memory, focus, or motivation, such as taking medications correctly, preparing meals, or adhering to follow-up care instructions. Additionally, conditions like delirium or sleep disturbances, which are common during hospital stays, can further exacerbate these cognitive and emotional challenges. Sensory impairments may be intensified in the hospital environment and can significantly impact a patient's ability to function independently after discharge. Changes in vision or hearing, whether temporary due to medications or permanent from pre-existing conditions, can hinder the patient's ability to navigate their home safely, recognize potential hazards, or communicate effectively with caregivers, thus increasing the risk of falls and social isolation. Lastly, environmental barriers present significant challenges when transitioning home. The patient's living environment may not be suitable for their current functional level, with obstacles such as stairs, lack of grab bars, or inaccessible bathrooms posing substantial risks. Furthermore, the absence of supportive equipment like walkers or shower chairs can prevent patients from safely and independently performing daily activities, emphasizing the need for home modifications and appropriate assistive devices to facilitate a safer recovery process. When the patient's ability varies between different tasks within a multitask item, report what is true for the majority of the included tasks, giving more weight to those tasks performed more frequently. For example, assessing the patient's ability to groom themselves daily should be prioritized over less frequent tasks, such as cutting fingernails safely. If the physician has ordered activity restrictions, these should be considered when selecting the most appropriate response for functional items related to ambulation, transferring, bathing, etc. It is essential to understand what tasks are included and excluded in each item, and to base your OASIS response solely on the included tasks. For example, in the bathing item, M1830, shampooing hair is not included. Although the presence or absence of a caregiver may affect how a patient carries out an activity, it does not impact the clinician's assessment of the patient's ability. Clinicians should determine and report the level of assistance the patient requires to safely complete a task. The level of ability refers to the level of assistance, if any, that the patient needs to safely complete a specified task. Report the patient's physical and cognitive ability to perform a task, and avoid considering the patient's preference or willingness to perform the specified task. In the context of OASIS assessments, intermittent supervision refers to any response that includes phrases such as intermittent supervision, reminded, must be placed within reach, laid out, or handed to patient. This level of assistance indicates that the patient requires occasional verbal or physical cues to safely complete the task. Minimal assistance is characterized by the patient's ability to perform the task independently with the use of a device or with minimal human assistance. This may include situations where the patient needs support from a person or device, or requires supervision to safely complete the task. Moderate assistance involves a higher level of support, where the patient needs more than just a device or requires continuous assistance from another person throughout the task's performance. Finally, total assistance is needed when the patient is completely dependent on another person to perform the task. This level is typically represented by the highest numerical response option for each question, indicating the most significant level of dependency. In conclusion, one of the primary goals of home care is to assist patients in transitioning back into the home environment. A crucial part of this process is assessing any decline in their ability to perform daily activities and supporting them in regaining strength and adapting to their new normal. To achieve this goal, it is essential to conduct a comprehensive assessment at the start or resumption of care. This assessment should accurately identify the patient's abilities prior to their current illness, exacerbation, or injury. It is equally important to assess the patient's current ability to perform ADLs and IADLs. During the assessment, have the patient perform the tasks as much as they are able. This helps establish a precise benchmark of their functional ability before any therapy is initiated. Timely submission of the assessment documentation is just as crucial as performing the assessment itself. Recent studies indicate that the accuracy of documentation decreases significantly with each passing hour after the patient visit. For instance, 4 hours post-visit, the accuracy of documentation drops to approximately 60%, leaving a 40% margin of error that can lead to issues needing correction later. This not only increases the risk of inaccuracies, but also complicates the care planning process. Therefore, prompt and precise documentation is key to providing effective and reliable home care.